Welcome to HITea with Grace, where we spill the tea on HIT. I'm thrilled to be here in sunny Las Vegas, interviewing industry leaders in health information technology. So tell me, who are you and what do you do?
So my name is David Bates. I'm the CEO of Linus Health, and we're a company that has an end-to-end clinically integrated brain health enablement and dementia prevention platform. So we really want to empower all the stakeholders of health to better care for brains and get people the resources they need to optimize their quality of life and independence.
I love that. I appreciate it so much. My grandfather passed away with Alzheimer's, and so the work that you're doing in brain health is very inspiring to me, and I'm so grateful for you putting science and technology and people to try to help this great challenge.
We're happy to do our part.
Absolutely. So, in this space, I'm kind of talking to leaders about what they think to be the industry's greatest challenge that people aren't really talking about.
The greatest challenge is to disseminate the information that there is hope, there's something people can do about it. Now with the recent tools and understanding, scientific advancement, there's a real opportunity for people to take agency over their own brain health and prevent disability long term. Brain-related disabilities are the largest disease burden in the world. Most people are resigned that there's nothing they can do about it, but that's not true. There's also massive stigma associated with it, which we need to remove, just like anything else, any other kind of health condition, except I would contend that brain health is most critical to who we are and our quality of life. And so it should be the #1 focus of society today.
Totally makes sense. Now, what trends are you hearing about in the health hallways?
In the health hallways here at the health conference, it's a gathering of a lot of companies and investors. And so some of the encouraging things I'm hearing are related to, a number of digital health companies have crossed the so-called chasm where they are having product market fit, but it's taken, it's taken a long time to get there because of how the healthcare system is resistant to change. It's hard to implement new innovations and technologies. It takes a long time. But I do have been interacting with a number of companies that are now have their proof points and they're seeking financing. And on the investor side, speaking with a number of investors, I do see a willingness of the investors to come outside of their standard criteria. So you see earlier stage investors going upstream, to later stage deals. They're expanding their aperture there, and you see later stage investors expanding their aperture to cover a little bit earlier stage deals that they're used to, kind of meet in the middle, because we had such a drought of investment in the past, call it since 2021, and now it seems that things are picking up again, even despite the political landscape with the government shutdown and all those things. It does seem there's still a bullishness to support these companies, because I think everyone agrees change has to come. Healthcare cannot sustain its current trajectory. We need innovation. We need AI to better serve the population at a lower price point.
So inspiring, and it's so great to hear that we've finally kind of gotten to that next level. Now, my listeners love to hear about what's happening in the space, but they also love to hear about what drives leaders like yourself. So if you could give your younger self a piece of advice, what would you tell him?
Hang in there.
Yes.
It's going to be a tough road, but remember why you're doing it. And to alleviate suffering for millions of people is, to do our part. It's worth it. And that's just to remember that.
Love that. So inspiring. Thank you for joining us. How can our listeners find you online?
For our website, www.linushealth.com.
Fantastic. So good to have you here, and thanks for sharing your wisdom with us.
Thanks so much, Grace.